Welcome to episode 140 of Real Health Radio. You can find the links talked about as part of this episode at the show notes, which is www.7, so the word all spelled out, seven-health.com/140. A couple of times a year, I take on clients, and client work is the core of my business and how I spend the vast majority of my time. And after working with clients for the last decade, I feel confident in saying I'm very good at what I do. And yes, I help clients with various symptoms, but actually it's much bigger than just removing symptoms. These are struggles that these individuals are obsessed with and are defined by. Their problem has become how they identify and think about themselves. My clients have often worked with multiple practitioners and are on the verge of giving up, and it really isn't uncommon for me to be the fourth or the fifth or the sixth person they've come to. And where I see myself being different to others is by combining science and compassion. So I'm evidence-based in what I do and have a strong grounding in physiology and why the body is functioning how it is. But at the same time, I'm compassionate and I listen to the mental and emotional side of the client's experience and know that these aspects are of equal importance to health as the physical side of things. And one of the aspects I like most about the work that I do is how positive the process is. People believe that they're going to have to give up so much, that it will be painful in so many ways, but they'll convince themselves that it's better for their long-term health. But what they find is that the change actually adds to their quality of life. They enjoy the change and their new life. Their physical, mental, and emotional health improves now, not in some distant, far-off time in the future. And after working together, my clients regain what they thought was impossible. Having their period again, conceiving, feeling energized, purposeful and alive, and walking by a mirror without the dread of seeing their own reflection. I put out so much free material. The podcast is free, the blog posts are free, and while the free material I put out I stand behind, it is much more general. You have to discern what is and isn't relevant for you. But when we are working together, I'm the one who can sort through this and show you what is important, what is the low-hanging fruit, and what are the levers that will make the most difference. So if you want this kind of precision in helping you with your recovery for better health, now is your chance to work with me. If you're interested in finding out more, you can head over to www.7-health.com/help, so HELP, and there you can read more about how I work with clients and apply for a free initial chat.
Welcome to Real Health Radio. Health advice that's more than just about how you look. And here's your host, Chris Sandel.
Hey y'all, welcome back to another episode of Real Health Radio. So this is the first solo episode that I've done in a while, and the solo episodes have become more of a rarity over the last 6 months, and I'm hoping to change that. And this week's topic is an area I've wanted to cover for a long time, and it feels very apt given the time of year we're in and the incessant focus on weight loss and dieting. And so the topic I'm diving into is weight stigma and the repercussions that it causes. As part of this episode, I'm going to go through a couple of papers, and one of them is a review that looks at many studies that have been done on weight stigma. And I'll then be sort of talking about the findings. And then there's a second paper, which is a collection of 3 studies. And I kind of see this topic in a similar way to cognitive dietary restraint. So I've already done 2 episodes on cognitive dietary restraint called How Your Thinking Affects Your Health, and I plan to do more, looking at more research around that. And it's the same with this topic. This is really just a starting point, looking at some of the research, but there's so much more that I won't get a chance to cover here. And so I would like to do it in part 2 and part 3 and so on. And I already have other papers that I want to go through and things that I want to discuss. And it feels like a topic that really needs more attention. And so I want to be able to shine a light on that as best as I can. So I guess the best place to start with this is to define weight stigma. So weight stigma refers to negative behaviors, stereotypes, and attitudes that are directed towards individuals solely because of their weight. And weight stigma is also known as weight discrimination. So it is the prejudice or the discrimination, whether overtly or covertly, based on someone's weight. And to show how biased we typically are about weight, let me use a thought experiment. When you hear the word thin, what comes to mind? There could be a whole range of words or images or things that come up, but my sense is that the associations with the word thin are either neutral or positive. And if you had a friend and you were asked to describe their body shape, if they were thin, would you hesitate to use that description? And my hunch is that you probably wouldn't think twice about using this word. And there's obviously going to be exceptions here. So say if that individual was struggling with an eating disorder, and so you're aware of using language about their body and not using that kind of language. But I would say on the whole, describing someone as thin is either neutral or a positive description within our society, and most people wouldn't think twice about using that word. Now I want you to think of the word fat. What comes to mind when you hear this term? And again, this could conjure up a wide range of ideas and images, but typically these are associated with associated with negative ideas. And again, there will be exceptions. If you're someone in the fat acceptance movements or into social justice areas, then maybe you've done work and the word fat isn't associated with negative connotations. But I would say that for the vast majority of people living in the Western world, the descriptor fat is negative. And if you had a friend and you would ask to describe their body shape, how comfortable would you feel using that word, the word fat, to describe them, especially if they were in the room and were hearing your description? And you might be thinking that the word fat carries with it a lot of baggage, but if you were to instead use other descriptors or other euphemisms instead, like larger body or heavier or bigger, how would you feel using that description or descriptor in front of your friend? And my sense is that there's much more likely to be some awkwardness or some uneasiness in describing a friend as fat or as heavy or as bigger versus describing a friend as thin. And I think this is a helpful starting point to show the biases that we have around weight. We would be less comfortable describing a friend as fat or heavy because these words have added meaning that had been attached to them by our culture. They aren't simply a description about someone's size. They are a subtle or maybe not so subtle commentary about their habits or their willpower or their discipline and all the other stereotypes associated with weight. And this stigma and bias has a huge impact on people's lives. It impacts on someone's employment at all levels, from interviewing and hiring processes through to salaries and promotions and disciplinary actions and dismissals. There's a paper entitled The Stigma of Obesity, a Review and Update, that found that weight stigma leads to difficulty obtaining a job, a worse job placement, lower wages and compensation, unjustified denial of promotions, harsher discipline, unfair job termination, and common derogatory jokes and comments from coworkers and supervisors. It impacts on the healthcare that someone receives, which is something I touched on during my conversation with Jess Baker. Individuals with a higher body weight are provided with less health information, they receive less time, they're viewed as weak-willed, unsuccessful, hopeless, and non-compliant by their doctors and their healthcare providers. And all of this impacts on the level of care that they receive. And this is in addition to the fact that many people are weight shamed by their healthcare providers, which has the result of making them avoidant of visiting their doctor, for example, meaning serious issues are often picked up later than otherwise would have been the case. And even in the area of politics, this is the case. And there was a study done by Michigan State University in 2014. And they found that overweight politicians or overweight political candidates tended to receive fewer votes than their thinner counterparts. And that if you were higher in weight, you were even less likely to make it onto the ballot to start with. And this research made me remember the book, The Obesity Myth by Paul Campos. And as part of the book, Campos spends a decent amount of time looking at and commenting on Bill Clinton and his weight and his weight loss efforts while running for presidency, as well as then Monica Lewinsky and the scandal and how her weight was portrayed and talked about in the media as part of this. And really in all facets of life, starting from the education that someone receives as a child through to the support and the care that they receive all the way until their end of life, weight stigma plays a role and a negative role. And when this is pointed out, the biggest objection that people have is that despite these negative impacts or potential negative impacts, it's that surely weight stigma is helpful in making people lose weight, in helping people make changes. And it's the idea that if people are told how bad it is to be in a larger body and all of the ridicule and all of the discrimination that comes with this, then this will be the impetus for people to make changes. That these negative experiences and stereotypes motivate weight loss and motivate health-seeking behaviors. That in a sense, that the end justifies the means. And this is really what I want to use the research papers that I'm going to talk about to address. Because the reality is this belief is a fallacy. Weight stigma doesn't have the effect that people claim it does in terms of being a motivating force. It really does the opposite. And this is incredibly important for everyone to understand. For me, I take a very weight neutral and non-diet approach. I'm not intentionally trying to help clients lose weight. While I believe weight can potentially have an impact on someone's health, it's a lot more complicated than most people think, and simply losing weight doesn't increase health. And weight is a poor proxy for health. But even if you completely disagree with my stance and that you think that weight in and of itself is problematic, if your goal is to change society as a whole and get people living in smaller bodies, then weight stigma is still not how this goal is going to be achieved. And honestly, I don't know how that goal is going to be achieved, but I at least know that weight stigma is definitely not the way to do it. So let me start by going through the different papers to really sort of flesh this out and why I think that that's the case. So the first paper is called Weighed Down by Stigma: How Weight-Based Social Identity Threat Contributes to Weight Gain and Poor Health. And it was published in June 2015 and came out in the journal Social and Personality Psychology Compass. And I will link to it in the show notes. So this paper isn't a study, but a review in the area of weight stigma, using many different papers and studies to look at a broad range of areas. And it starts out by looking at the idea that weight stigma leads to weight loss and healthy behaviors, and if this is really true. Because this has been the premise of many campaigns to try and tackle the so-called obesity epidemic. So it makes reference to the Strong for Life campaign from Children's Healthcare Atlanta. So this was a campaign that got a lot of attention. And in the advertisements, it would show a picture of an unhappy and overweight child with text underneath. And they would read something like, "It's hard to be a little girl when you're not," and "Fat prevention begins at home," and the buffet line. Now, there's two important parts to this advertisement, as well as the other advertisements that subsequently have come out from Strong for Life that I want to mention. So one is that there is this reliance on stereotypes about those who are overweight and obese as being depressed and lazy and lacking self-control. And the other is that obesity is simply about an individual making poor choices and that anyone can control their weight if they just cared enough. And basically the burden lies squarely on the individual, irrespective of circumstances or outside forces. So the rest of the paper then looks at what evidence says about this. And one of the ideas that the paper mentions is the concept of social identity threat. So let me quote the paper to explain what this means. Quote, "A social identity is the portion of an individual's self-concept derived from perceived membership in a social category or social group. So social identities can be achieved, being a professor. It can be ascribed, i.e. being African American. It can be valued, i.e. being a doctor, or devalued, i.e. being an alcoholic. And in the case of weight, when people categorize themselves as an overweight or a fat person, or believe that others categorize them as such, it becomes a social identity that is shared with others also perceived to be overweight. So the paper then goes on to say, overweight and obese individuals are well aware that being overweight is culturally devalued and of that pervasive negative stereotype of the pervasive negative stereotypes that accompany this social identity. This awareness makes overweight individuals vulnerable to experiencing weight-based social identity threat. Weight-based social identity threat is a situationally triggered psychological state in which an individual is concerned they have been or will be devalued, discriminated against, rejected, or negatively stereotyped because of their weight. End quote. So social identity threat is really at the heart of weight stigma and its repercussions. Like everything else trickles down from it. That if being in a larger body was neutral, then the other issues wouldn't arise. So what are these other issues? So the first you have is psychological stress. So weight-based social identity threat is psychologically stressful. Research in both adults and adolescents has demonstrated that stigma increases cardiovascular reactivity, so things like increased blood pressure. It activates the hypothalamic pituitary adrenal axis, which is largely responsible for the body's stress response. So as part of this, cortisol is increased, and higher cortisol is often associated with stress-induced eating and typically towards eating higher calorie or highly palatable foods. Increased cortisol also affects food partitioning, so how much is being used for energy immediately versus how much is being stored for fat. So basically, this increase in cortisol, because of the social identity threat, is creating the exact opposite situation of what would be hoped for if weight stigma was really a tool for helping people to lose weight and increasing healthful eating behaviors. Weight discrimination is also correlated with higher levels of markers for oxidative stress, as well as for high levels of C-reactive protein, which is a marker for inflammation. And these are markers that are associated with diseases such as hypertension, cardiovascular disease, insulin resistance, and diabetes. And what's interesting about these illnesses is that they are often thought about as being stress-related diseases. So while it's often explained that in someone with obesity, it is the weight itself causing the issue, it could be more about the stress suffered at the hands of our beliefs and prejudices about that weight. The next area that weight stigma has an impact on is executive function and self-regulation. So continuing on with the concept of self-identity threat. If you are in a larger body or feel that is how you are perceived, you have to deal with the potential threat of weight stigma. So you're constantly worrying about how you will be judged. Will someone make a joke? Are people thinking about your weight in a negative light while they're talking to you, etc.? And in this scenario, there are really two options. One, that you work hard at suppressing those thoughts, or two, that you work even harder to try and impress people. And both of these options are a cognitive burden. So you aren't free to just be you, you're living in your head and you have this task of suppressing or impressing others and running parallel with whatever else you're having to do. And this has then a knock-on effect in undermining performance on tasks that also require executive control, like working memory tasks. It also reduces the ability of self-regulation, so the ability to avoid tempting but less healthy food. The next area that weight stigma impacts on is psychological health. And I know I already mentioned psychological stress, but this is looking at things more broadly. So according to the research referenced in the paper, many of the psychological effects attributed to carrying excess weight, so such as low self-esteem, greater depression and anxiety, and poor quality of life, result more from the stigma faced by overweight individuals than from the weight itself. And let me quote the article here to demonstrate this further. Quote, using a nationally representative sample of overweight and obese individuals Hatzbella and colleagues found that those who had experienced any weight discrimination during the previous 12 months compared to those who had not were twice as likely to have current mood and anxiety disorder diagnosis and nearly 50% more likely to have a substance use disorder. Moreover, individuals who reported weight discrimination were 3 times as likely to be in the highest quartile of perceived stress. Importantly, these effects held when controlling for BMI, highlighting the importance of social treatment rather than the objective weight status per se. And so there are 2 things that I want to mention here. The first is that this helps to demonstrate that this is about discrimination, not the weight. It's easy to blame someone's weight as the cause and say that if they were at a lower weight, then they wouldn't have the mood or the anxiety disorder. But in fact, it's not the weight, and the discrimination was the real issue, and this held even when they controlled for BMI. And the second is that I've seen this with many of my clients, irrespective of their actual size. So many clients that I work with live in bodies that match up to our society's norms, and their BMI would be in the normal range. But due to weight stigma, and this is often at the hands of their own parents or relatives through childhood and during adulthood, they deal with various kinds of mental health issues. And connected to this, the authors proposed that, and again I'm going to quote, weight-based social identity threat undermines mental health in part because it threatens the fundamental need for social connection, end quote. So because there are all these negative associations attached to being at a higher weight, individuals can feel like they aren't going to be accepted. And the next area the paper then touches on is that weight stigma increases the motivation to avoid stigma. Now, you may be thinking that this is in the domain of weight loss. So to avoid stigma, you lose weight. Well, weight loss is something that I'm going to deal with in a moment when I look at someone's attempt to escape stigma. But in terms of avoiding stigma, this is where an individual removes themselves from situations in which they are more likely to suffer that stigma. And unfortunately, this can often be situations that are important for health. So for example, exercise is one domain. Individuals can avoid exercise because of the fear of stigma, which is particularly the case in a public setting. So despite exercise being something that is healthful, irrespective of what happens to someone's weight, individuals can feel that there is a higher chance of stigma, and so it's avoided. And the same thing with going to healthcare providers, which I talked about at the beginning. And to quote the paper again, with high levels of explicit and implicit weight bias among medical trainees and professionals, which are well documented, including those specializing in obesity, healthcare professionals are cited as a frequent source of weight stigmatizing encounters, and obese patients report feeling disrespected, criticized, and blamed for their health problems by their physicians. As a result, overweight and obese individuals may be less likely to engage in age-appropriate preventative care compared to their thin counterparts, so e.g. cancer screenings, putting them at additional risk for compromised health, end quote. And this avoidance can also be avoidance of family or friends or generally making connections, because these relationships can often be a source of stigma. And so individuals opt out, leading to isolation. And I was recently listening to Brené Brown's new book, Dare to Lead, and in it she talks about the health implications of loneliness and isolation. And I haven't read Johann Hari's new book, Lost Connections, but I've heard him talking about it on Sam Harris's Waking Up podcast, and he talks about the same thing. And both make reference to John Cacioppo, I think is how to pronounce the guy's name, who is probably done more on the work of loneliness than anyone else. And the health outcomes that are associated with it are really damning. And what's interesting is that the diseases that are often associated with obesity, like heart disease and arthritis and diabetes and dementia, for example, are also associated with loneliness irrespective of someone's weight. So kind of like the comment I made with stress, is it really the weight per se, or is it cultural responses to weight and the stigma that is the real issue? So the next area the paper looks at is how weight stigma increases motivation to escape stigma, which is, as I mentioned a couple of minutes ago, the realm of attempting to lose weight. So this is the point most crucial to the argument for weight stigma, that it supposedly gets people to lose weight. And unfortunately, this isn't the case. Instead, what it tends to do is increase disordered behaviors around eating and exercise. For example, it leads to teenage boys and girls skipping meals or taking diet pills, which then can lead to increased binge eating. So let me do like a little thought experiment. Let's imagine that someone is regularly following habits and practices that are having a negative consequence to their health. So they are getting much less sleep than they need, and for many hours before going to bed, they're staring at a screen. They are sedentary, rarely doing anything that could be described as exercise, and spend most of their time indoors. Food that they eat is mostly fast foods, and they have a low consumption of fruits and vegetables. They're doing multiple jobs just to pay the bills, and they feel uncertain about money and the mortgage and paying the rent or paying the rent. They are in a relationship that is not in a great place, and both themselves and their partner struggle to communicate properly with one another. And there are going to be people all across the weight spectrum following the kinds of behaviors that I've just described here. But let's imagine that this person is in a larger body. You take this person and then you make them feel bad about themselves. You tell them how unsightly their body is, or how much of a drain they are on the national service or on taxpayers. Like, what do you think the response is going to be? Rarely is it going to be someone taking an objective look at their life and thinking, how can I make some sustainable changes that are going to improve my health? I wonder what I could do to improve my sleep. I wonder what fun ways I could find where I can enjoy moving my body so I can be spending more time outdoors. Is there someone I could ask about getting help, like retraining to help with job security? I wonder who could point me in the direction of a book or a podcast that could help me understand how to have proper conversations and communicate properly with my partner so I could have a better relationship. These are all things that could help this individual's health. And if they were supported in a compassionate way, they could identify them as areas of things to improve on. But that's not what happens when you make someone feel shame for who they are and the body that they live in. When you do that, it leads to people making drastic and disordered changes in an attempt to get out of their current body as quickly as possible, which isn't healthy or sustainable or leads to the goal that they have in mind. Or it leads to people becoming apathetic and avoiding exercise and using food for comfort. So let me share the quote from the conclusion of the paper. Although stigma is sometimes justified as a way to encourage weight loss and motivate healthier behavior among overweight individuals, growing evidence suggests that such efforts are likely to backfire. Rather than being an effective solution to obesity, weight stigma functions to threaten the social identity of overweight and obese individuals, initiating a cascade of physiological and psychological mechanisms with negative implications for mental and physical health. By increasing stress processes, undermining executive control and self-regulation, and increasing the motivation to avoid and or escape stigma, weight-based social identity threat contributes to and exacerbates obesity-associated diseases and promotes weight gain and retention. End quote. So I'm hoping that this has given a good overview of weight stigma and of the many problems that it can cause. I now want to just look at one other paper, and it's called Perceived Weight Status and Risk of Weight Gain Across Life in US and UK Adults. And it appeared in the International Journal of Obesity in September of 2015. So this paper actually included 3 studies. And these studies were done by looking at longitudinal data sets. 2 of them were from the US and 1 was from the UK. And so the paper wanted to look at how our perception of our current weight would impact on our future weight. So to quote the paper, some overweight individuals underestimate their actual weight status and do not identify that they are overweight. Until now, it has been presumed that the significant proportion of overweight individuals failing to recognize that they are overweight is a cause for concern, because this may result in little motivation to modify diet or physical activity and attempt weight loss. So, what the paper wanted to identify was, is this true? Does perceiving oneself as overweight help in managing one's weight? So in study 1 and study 2 for the paper, it was actually asking the same questions. So they were just using different samples. One is from the US and one is from the UK. So in a sense, study 2 is a replication of study 1. So in each of the studies, the participants were asked to rate their weight on a scale ranging from 1, which is very underweight, 5, very overweight, with a midpoint of 3, about the right weight. And then the participants' weight was also checked, so they could calculate their actual BMI. And they then looked at the client's weight at the start of the study and then years later to see what happened. And in the case of study 1, it was 7 years later, and in the case of study 2, it was 22 years later. And in both studies, what they found was that perceiving oneself as overweight was then associated with an increased risk of weight gain. And what they also found was that the effect that perceived overweight had on weight gain was not dependent on whether participants' perception of overweight was accurate or inaccurate. So basically, if someone wasn't overweight, but they perceived themselves as being so, it was associated with a risk of weight gain. If someone was overweight, but perceived themselves to be of a normal weight, there wasn't an increased risk of weight gain. So perception matters, and as these two studies show, it can matter in counterintuitive ways to what people would expect. So the third study as part of this paper was then about trying to understand why this was so. Now, this study, like the other two, was using longitudinal data, and because of this, you can't work out cause and effect. What you can look at is correlation. So what variables are correlated with the weight gain? So for this study, they started like the earlier two. So looking at people's perception of their weight, what the actual BMI was, and then following up years later to see what happened with that person's weight. And in this study, they followed up with the participants 9 and 10 years after the original intake. There was then two added elements with this study. One was asking participants about stress-induced eating, like the extent to which they typically respond to stress by eating more than usual or eating more of their favorite foods to enhance their mood. And then there was a second element asking the participants if they experienced discrimination based on their height or their weight or other aspects of their appearance. And the result in this study were similar to the previous two. So perceiving oneself as overweight, irrespective of whether this was true or not, was associated with an increase in BMI over the 9 and 10 year period. And when they then looked at stress eating, if someone perceived themselves as overweight, they had a higher likelihood of eating in response to stress versus someone who didn't perceive themselves as overweight. So this could be one of the possible explanations for why perceived overweight status predicted future weight gain. But as I said a moment ago, this study can only demonstrate correlation. It can't demonstrate causation. And I really like this paper because it's not a single study. It's replicated its findings across 3 different data sets, and it's all getting the same results. And the paper also makes reference to studies done, or other studies done, so with healthy weight and overweight adolescents. And those who perceive their weight status as being overweight are more likely to become obese by early adulthood. And part of the proposed mechanism for this is social identity threat and the negative associations we have around weight and being heavier. So that is it for the papers that I wanted to go through in this episode. Health and weight is a complicated issue. And when we live in societies and in nations and we're trying to make decisions and recommendations and messaging that is going to be helping a whole country, it's not an easy task. But what seems to be fairly clear is that weight stigma isn't a helpful method. While there will always be some outlier who says that weight stigma was the thing that helped to make them change like in positive ways, on the whole, this isn't what the research shows. It doesn't lead to weight loss. It doesn't lead to healthier behaviors. It leads to the opposite. So this isn't the last you've heard from me on this topic. I feel like I've barely scratched the surface, so I will definitely be back with a part 2 in the not so distant future. And as I said at the beginning, I'm currently taking on new clients. I only do this twice a year. If you'd like to find out more, you can head over to www.7-health.com/help. There you can read about how I work with clients, and if you're interested, you can apply for a free initial chat. So that is it for this week's show. I will be back with another episode next week, and I will catch you then.